Sore throat is a common childhood complaint. It can be of many different natures. It doesn't mean that the sore throat is an infectious process which requires antibiotics. The proper history of when the sore throat started, how long it's been going on, what have you done to relieve it, are there any other associated symptoms like fever, cough, colds? These are all symptoms that need to be notified to the pediatrician, and the pediatrician can then make a better assessment. At that point, he will ask you to come in and be evaluated. If the sore throat looks like it's viral, then probably you'll wait. If the sore throat looks like it may be from a weather change or allergy related or some other symptom, he might ask you to do some symptomatic relief with saltwater gargles, taking some pain medication, and wait and see what happens. If there's a suspicion that this is infectious, a throat culture might be done, which would be then sent to the lab. A quick strep test can be done, which can give you good results right away. However, those results aren't that accurate and are only about 80 to 90%. So if the quick strep test is negative, still a throat culture might need to be done, and that culture would be sent to the lab. The results from the lab can take 2 to 3 days often. During that time period, if the child looks sick enough looking, the pediatrician might start with antibiotics and then wait for the results to come in. Once the results come in, if the child is positive for strep throat, the antibiotics would be continued. If the child is negative for strep throat, the pediatrician would probably ask you to stop the antibiotics. Or sometimes, if the culture is done and the child doesn't look sick enough, the pediatrician will tell you to wait and not start an antibiotic. However, they would at that time tell you to do some symptomatic relief with saltwater gargles, pain medications, warm soothing liquids, and waiting, and waiting.